Post-traumatic stress disorder at the Homewood, most of the people were in post-traumatic stress recovery. This is a new one that's an oldie, but a new one that's gaining momentum. Not everybody who suffers from a trauma suffers from post-traumatic stress disorder. Okay? There has to be a distinction there. We were all traumatized by the events of 9/11. All of us were traumatized. For some of us, it might have elevated an underlying already anxiety problem. We may have had some nightmares about it in the beginning, but it was our brain trying to wrap our heads around exactly what was happening, even though we couldn't possibly know all the story. For post-traumatic stress disorder, folks, it doesn't go away. The nightmares, the thinking about it, right? As a massage therapist, you could be sitting there giving somebody a massage, beautiful, quiet music, and all of a sudden in your head you hear the screech of tires, the smash of glass, screams, start to sweat a little bit more, and then you realize you're giving a massage. So for folks who have the post-traumatic stress disorder, there's certain guidelines that have to follow in order for it to be this diagnosis. But flashbacks are the big one, the nightmares, the hypervigilance is a big one. Hypervigilance about everything. Unfortunately, PTSD is not limited to soldiers. A lot more of the Canadian soldiers are seeing more. We used to be peacekeepers. People used to love us around the world. It was a little bit different after World War II. But now Canada is seeing more of a role. Our soldiers are seeing things that they didn't see for many years. Our first responders, ambulance workers, nurses, ER docs, okay? I say ambulance, fire trucks, police. It's becoming more relevant in their trainings and in the things that they're doing within the profession. And the stigma is starting to lessen a little bit about going to see a therapist because you're suffering from post-traumatic stress disorder. Because mental health disorders, if untreated, can definitely decrease life between 10 and 20 years. So if you don't get it treated, if you don't get it addressed, you can actually shave 10 or 20 years off of your life. And of course, it goes without saying, the rest of your life might not be so charming and wonderful and happy. But as massage therapists, we can make a tremendous difference. And this came to the forefront for me a couple years into my practice. I was having a crazy busy night, just one after the other, which was good, young family, everybody's got to eat. So I was working very, very, very fast. And unfortunately, I wasn't really looking at my intakes very well. I was looking to see the person's name and to see if it was their birthday. Because everybody loves to hear happy birthday, and a lot of people come down for massage therapy on their birthday. So, going through, I had a lady come in, and clearly physically, just from a quick physical exam, it wouldn't take a trained healthcare professional to see this. Something had happened. She had a sort of bandage patch over her eye. Her left cheek didn't look like her right cheek. The eye that was still functioning, she kind of had this look, that hypervigilance I'm talking about. She was just kind of checking me out. And she came into my treatment room, and so I'm going through the 7 steps of consent, and she's just nodding yes, shaking her head no, nodding yes, shaking her head no. So okay, well it's about as enough consent as I need. She seems to be okay with it. She's had massage in the past. Okay, that's great. Get her on the table. I treat her. She got up and left about as quietly as she came. Didn't really have much to say, except thank you. So she came to see me a couple times, and the third time she came to see me, I thought, you know what, I got to work on her head today. I've been trained in osteopathy, craniosacral therapy, osteopathy in the cranial field. Something told me I have to work on her head. I just have to. So she came in and she sat down, and I said, if it would be okay with you tonight, I'd like to spend 20 minutes just working on your head and your face. And she's okay. She nods okay. So we're doing the treatment, and gets to the point where I ask her to turn onto her back. So I've got a good 25 minutes to work on her head, her face, all around, tugging on her ears, doing all these things. I leave the treatment room. I hear the door open a short time later. She comes out and she's crying. And I thought, wow, you just stepped way over the line this time, Chris. You know, what did you do? And I said, is everything okay? And she said, everything's wonderful. She said, you're the first healthcare professional in 15 years to touch my face and not ask me what happened. Okay. What happened? You know, I'm thinking in my head, I didn't say it, because I'm waiting, and she says, ever since the bear attack, I've always been treated like a bear attack victim. People have always come in and just pointed to my scars. They didn't listen to me. They tried to give me a fake eye. It got infected. They wouldn't listen to me. Had to take it out. When they were fixed, she's just going on a story, and all of a sudden my eyes were this big. And I'm going, I'm nodding and shaking my head. And she says, okay, well, I won't take up much more time. I'll see you next time. And she walked away, and as I picked my jaw up off the ground, I looked at the notes, initial intake, reason for treatment, bear attack. Now, yes, I was a little negligent in my note keeping. Sorry about that, Sarah. Didn't have a digital RMT at the time. But I learned the lesson that I'm not treating post-traumatic stress disorder. I'm not treating addictions. I'm not treating disordered eating. I'm treating the people with that dysfunction. And it was a very powerful lesson, and I'm glad that I learned it early in my career, because it kind of completely changed my paradigm around treating. Because I kind of learned that, yes, I have to read the treatment notes, I have to know what's going on, but then I have to kind of disregard that and treat what's going on. Ask the right questions.